now. You're gonna do great. And whenever you're ready, you can begin on your own, however, however you're ready, whenever you're ready. And I'll hit the start button on the first word of your presentation, okay?
Okay. Okay. Hello and good morning. My name is Braden Mills, and today I'm here to help save lives from the opioid epidemic we are all facing today all over the world. I'll be speaking about the impact of opioid overdoses and how this global problem can be solved. In today's world, people are abusing drugs on a daily basis and are doing anything they can to get them. It's to the point where many can't live without them and end up suffering death in the long run. For those who may not know what opioids are strong drugs that are used to get rid of pain, but have many negative effects on the body, especially the brain when used incorrectly, as you can see on the screen right there. With a show of hands, how many of you know someone that has died from the drug overdose? Exactly. Sadly, 130 Americans die every day from opioid overdose. Back in 2017, 47,000 people were killed from opioids in the United States, being higher than vehicle accident-related deaths and homicides. In fact, the rate of opioid overdose deaths in Mississippi has doubled since 2000. Also in Mississippi, there are 12.2 drug overdose deaths per 100,000 people, which is an extremely high rate. Not only is this happening in the United States, it is happening in other countries such as England, Sweden, Estonia, Norway, Australia, Ireland, Lithuania, and Finland, which all have reported extremely high opioid overdose death rates. Estonia is listed at 135 deaths per 1 mil population, Sweden at 90 deaths per 1 mil population, Norway at 75 deaths per 1 mil population, Britain at 73 deaths per 1 mil population, Ireland at 65 deaths per 1 mil population, Denmark at 55 deaths per 1 mil population, Finland at 55 deaths per 1 mil population, and Lithuania listed at 45 deaths per 1 mil population. So the question is, what is causing this and how can it be reduced? Overprescribing and access to drugs on the streets as a result leads to opioid abuse and overdose. For that reason, the most effective solution has to be one that influences the standpoint of people on prescription drugs. Based on my own extensive research, leveraging prescription drug monitoring programs is the most effective way to combat the opioid epidemic. There are several points to take into consideration about the positives of making these programs more efficient to prevent further chaos in the future. Leveraging prescription drug monitoring programs will give clinicians a more complete picture of their patient's medical history. In 2011 to 2016, the Journal of Pain and Palliative Care Pharmacotherapy conducted a study of prescription drug monitoring programs being implemented, and 84% were aware of the existence of the state PMP, and 59% who are aware of the program had never used it. Applying these programs had a significant impact on both awareness and utilization of the system, which allowed for others to see how prescribing practices can be improved. Secondly, these programs help reduce doctor shopping to obtain prescriptions from multiple clinicians. Today, e-scripts are used as electronic prescriptions instead of paper and are electronically filed through a computer to the pharmacy's database. In 2012, Florida adopted prescription drug monitoring program, seeing a 35% decline in doctor shopping for people who were visiting 5 or more prescribers and pharmacies within the time of 90 days. This decline happened for a reason, which allowed for 2.3 million queries to be logged over to its database by physicians. This contributed to a decrease in drug overdose deaths by 6.3%. Last but not least, prescription drug monitoring programs can improve medical care. In 2013, California's Workers' Compensation Institute reported an estimate of money that was saved by advanced opioid managing controls being $57.2 million. The backbone of this was only made possible by the prescription drug monitoring program that was made essential. So, how can opioid overdoses be reduced worldwide? It is evident that there is not just one solution for the opioid epidemic we are facing, much less is there only one cause. More research is going to have to be required in order to combat all the contributing factors. For now, the most effective solution, as we have seen in Florida, is to make more efficient prescription drug monitoring programs in order to maintain opioid overdoses. Drugs has changed the world and negatively impacted people, resulting in many abusing drugs on a daily basis, which then leads to death later on. If the programs are put into action, countries struggling with opioid-related deaths will see a significant decrease in numbers worldwide. Thank you.
Woohoo! Fantastic job, man. And you hit 6:18, so that's solid. Let me hit the pause on the recording. I'm restarting the recording. You're gonna be wonderful. You're gonna do fantastic. Whenever you're ready, I'll hit the start on the stopwatch on your first word of your presentation.
Good morning. My name is Mary Williams. Today I'll be speaking about the opioid epidemic. The opioid epidemic is when addictive opioids are abused and result in overdoses and economic consequences. The question today is, how can the number of opioid overdoses be reduced? The National Center for Biotechnology Information reports that 16 million people around the world are addicted to some kind of opioid. Whether these drugs are purchased on the street or prescribed by a doctor, they're pretty costly. However, there have been cheaper, more addicting alternatives to opioids. In 2018, the worldwide number of opioid overdoses totaled up to be 585,000. Lots of these involve the use of morphine, which is one of the cheaper alternatives provided. According to the Center for Disease Control and Prevention, in 2018, 41 people on average died per day from opioid overdose. This added up to approximately 15,000 deaths that year. Something needs to be done to reduce the number of opioid overdoses because it's costing countries millions, if not billions of dollars. Now, raise your hand if you love music. All right, now how many of you listen to an artist who is now gone due to overdose? Well, there have been numerous musicians and artists that have died because of accidental and intentional overdose. Who liked Prince? He overdosed on fentanyl. What about Mac Miller? Also fentanyl. And Elvis Presley, there were so many drugs taken, but codeine and Demerol were just two of the opioids found in his toxicology report. These are just 3 out of the countless number of celebrities who have overdosed. The amount of overdoses across the world is rising, most likely because of how easy these opioids are to acquire. Opioids are prescribed to patients in order to treat pain. There are natural, synthetic, and semi-synthetic opioids. Synthetic opioids are drugs made to act like the natural ones. However, they are typically stronger and more addicting. Some natural opioids are codeine and morphine. Semi-synthetic examples are hydrocodone, oxycodone, and heroin, which is made from morphine. Fully synthetic opioids consist of fentanyl, pethidine, methadone, and tramadol. In the last few years, the U.S. has had a large issue with overdosing on synthetic opioids. The CDC says opioids, mainly synthetic opioids, are currently the main driver of drug overdose deaths. The National Institute on Drug Abuse states that nearly 80% of heroin users abuse prescriptions first. With this being said, lots of people have turned to synthetics because they provide a more powerful, longer-lasting high. It's reported that areas with higher prescription rates have been small towns that contain a higher white population, more physicians and dentists, higher unemployment rate, and more people living with a disability, obviously. While these opioids are prescribed to patients due to pain, they can easily fall into the hands of patients and non-patients in many ways. Doctors can overprescribe for money, patients can allow friends or family members to take their prescriptions, or they can be purchased from the streets. Because they're so easy to find, the United States rate of overdoses keeps increasing. The US is not the only country that has opioid issues, though. The European Monitoring Center for Drugs and Drug Addiction says that there is an underestimate of the 2017 opioid overdose deaths in Europe, sitting at more than 9,000. The death rate in Europe from opioids has been increasing throughout the last 5 years, and reducing them is a major challenge to European public health policy. The EMCCDA says that most of the overdose deaths occur after completing a rehabilitation or detox program, being let out of jail, and being released from the hospital. Fentanyl is largely overdosed on in Europe, just like the US and Canada. However, it has been noted that many of the overdoses reported have been taken with something more than just the opioid, such as alcohol. It is known that if synthetic opioids are taken with anything else, big or small amounts, that the risk of harm or overdose is boosted. Making the less addictive options cheaper has not been the best solution, as lots of them are more addictive than natural opioids. According to rehabspot.com, research shows that insurance companies have frequently pushed cheaper, more addictive prescription opioids over less addictive alternatives. For example, morphine has a higher addiction risk, but many insurance companies have put it in the lowest cost tier. Morphine is just one example of a cheaper, more addicting alternative. It was intended to be less addictive, but clearly not. While raising opioid prices could be a potential solution, anybody and everybody could find a way to acquire them no matter the price. Finding the doctors who were overprescribing should be penalized, whether it be paying a large fine or losing their license. The CDC refers to the opioid epidemic as an economic burden. They made an estimate of how much prescription opioid abuse costs the United States, which was $78.5 billion per year. It costs so much because of rehabilitation programs, overdose and addiction treatments, healthcare, jails, and hospitalization has to be paid for. Everything comes down to money. The doctors who are overprescribing do so for money. If they had the potential to lose money or their license, they would most likely stop what they're doing, which would reduce overdoses. Dr. Ronald Harris is a physician who wrote the article, The Opioid Epidemic. It's time to place blame where it belongs, which is a prime example of what I'm saying. He says that there are two different types of physicians, those who overprescribe because they truly don't want their patients to endure pain, and the ones who are just in it for the money. He claims that they don't want to give the patients less than they need, but that it can be a risk to overfill. One example Dr. Hershey mentioned was the leftover pills that are still sitting in the medicine cabinet at homes. They can be stolen from the patient's home by a close relative or friend, or the patient can give them to anyone if they feel that they do not need them anymore. An innocent act of simply caring for the patient's pain tolerance can result in misuse. He refers to the corrupt doctors as pill mills, saying that they are the ones who only accept cash in exchange for the pills. Whether they're prescribed or not, or natural or synthetic, he mentions a doctor in his own town who met people in a local coffee shop. He refers to them as his patients and sold pills to them. He was caught and revoked of his license, which probably saved many, many patients from opioid overdose. If more people like this doctor were being caught and penalized, the amount of overdoses would be greatly reduced, and it would work to save the country's economy. In closing, the answer to the question, how can opioid overdoses be reduced, to catch and penalize corrupt physicians and others selling these prescription opioids on the streets and in local meeting places. Opioids are being overdosed on a daily basis around the world due to the fact that they're so easy to obtain. The United States and Europe are just two locations on the globe that were discussed, and there are so many more that deal with opioid misuse as well. To drop the opioid overdose rate and help save country's economy a few $1 billion, the use of opioids needs to be greatly reduced. Thank you.
Woohoo! Let me hit your, yeah, you went over 7 minutes. Fantastic job. Did a great job. Let me stop the recording. And it's already on screen. You're going to do fantastic, Marlon. All right. So you're large and in charge, girl. It's you. You're going to do this. Let me reduce this. Okay. I will begin your timer on your first word. Okay.
Good morning. My name is Marley Mills, and today I'm going to be talking to you all about an issue that has not only become prominent in the United States, but in many other Western countries, including the United Kingdom, the Netherlands, and Israel. According to the CDC, this issue has made its way to being the main driver of the ever-increasing drug problem in the United States. What is this issue? It's opioid misuse and, in many cases, overdose. In 2018 alone, over 67,000 people died due to drug overdose. Opioids were involved in nearly 47,000 of those deaths. The deaths due to opioids are usually caused by synthetic opioids, and the states that had the most of these deaths were Virginia, Delaware, Maryland, Pennsylvania, Ohio, and New Hampshire. So now that we know about the issue, the question is, how do we solve it? Well, by doing some research, I found that implementing policies that expand electronic prescribing of controlled substances, or EPCS, could significantly help the issue by mitigating prescription errors and making the entire prescribing process more precise. Electronic prescribing, or e-prescribing, can be defined as the computer-based electronic generation, transmission, and filling of a prescription, taking the place of paper and fax prescriptions. E-prescribing has the most potential to thrive in a community-based setting. Let's talk about the specific ways that e-prescribing could reduce the amount of opioid misuse and overdose around the world. According to the Institute of Medicine, about 1.5 million preventable adverse drug effects, or ADEs, occur every year in the United States alone. Every year, 7,000 to 9,000 deaths take place due to poor handwriting and prescription filling errors. These issues may not seem like they have a large effect on ADEs, but the numbers show they actually do. According to a study, thousands of deaths are occurring because of errors made in the prescription process that could easily be prevented. Electronic prescribing would completely eliminate the issue of poor handwriting, so there isn't any miscommunication between the doctor and the patient. A study was performed in which e-prescribing was adopted for a year in 12 community-based practices. In this study, doctors were provided with a free e-prescribing web tool called ERX. This program was meant to assist physicians in learning how to write prescriptions electronically. This was all in an effort to decrease the number of prescription errors that are certainly preventable. After 1 year of using electronic prescribing systems, the results were astonishing. The study found the error rates went from 42.5% per 100 prescriptions to 6.6% per 100 prescriptions. In another study, in an ambulatory clinic setting, 17 physicians were also given an ERX system to implement. In this study, prescription error rates went from 35.7% per 100 prescriptions to 12.2% per 100 prescriptions. These numbers show that e-prescribing almost eliminates errors in the prescription process. The reason that these results are so astonishing is because electronic prescribing greatly increases the legibility of prescriptions, which makes them much easier to read. If a doctor's handwriting is not very legible, this leaves a lot of room for mistakes to be made in getting the correct medication and dosage to the patient. If the patient gets the wrong medication or wrong dosage, this is putting them at risk to have adverse drug effects, such as addiction. Electronic prescribing nearly eliminates the chances of a patient getting an incorrect prescription due to poor handwriting. Handwriting should never be the reason that a patient receives an incorrect prescription that could lead to adverse drug effects, such as addiction. An increase in legibility is not the only way that we can reduce prescription errors, though. E-prescribing would also give doctors all of the background information that they need on patients before prescribing them a medication. Most ERX systems also include medication decision support. This helps physicians to bypass any errors in the prescription process and helps to avoid adverse drug effects. While this might not seem like it would make a big difference, a patient's medical background can determine whether a medication will negatively affect them or not. E-prescribing systems make patients' prescription formularies and eligibility information readily available to doctors in order for them to make the best choice for their patients. This will reduce the probability that the medication will cause an adverse drug event. The more prescribers know about their patients, the easier it is for them to choose appropriate medications. This overall reduces the chances of a patient becoming addicted to prescription medications such as opioids. Another way that electronic prescribing would help to reduce opioid misuse and overdose is by reducing the chances of forged prescriptions. Giving prescriptions electronically allows doctors to communicate directly to the pharmacy, not through the patient with a piece of paper. Implementing these electronic systems would also help prescribers to know what the patient has already been prescribed in the past. Electronic prescribing would let doctors know if a patient has been doctor shopping. This is the term for when a patient goes to multiple doctors in order to receive different prescription medications. A survey taken by the U.S. Department of Health and Human Services estimated that between 2002 and 2011, about 25 million people used prescription opioids for non-medical purposes. This goes to show how prominent opioid misuse has become in recent years. Implementing e-prescribing everywhere that we can would help to reduce this number by allowing prescribers to evaluate the backgrounds of their patients when deciding which prescription is best for them. In conclusion, I believe that implementing electronic prescribing would help to greatly reduce the 47,000 deaths that take place every year due to opioid misuse. Electronic prescriptions would increase the legibility and reliability of prescriptions. Prescribers would be able to decide what is best for their patients based on their background information that electronic systems would make readily available to them. The amount of fraudulent prescriptions would be reduced by creating direct communication between the prescriber and the pharmacy. By implementing electronic prescribing systems, I believe that we could greatly reduce the amount of opioid misuse and overdose. Thank you.
Whew! Solid. You were flying, girl. that was good stuff. If you don't mind hitting stop share, you did an awesome job. Proud of you. You hit 549, so even you got a lot of words in that 549. I'm here to tell you. Okay, and now I will highlight Clay's here. So now you feel comfortable about it now that you've seen one happen there, Clay? You good? Okay. Let me pause the recording while you're getting it prepared. The recording. Once you begin, you are in control. It's all yours, my man. You worked hard on this. You're going to do great. You got your script in front of you. You're in a comfortable environment. You're going to knock it out of the park. I know it. The only way I'll actually interject anything at any point is if you hit 8 minutes, just to kind of let you know you're there. Okay.
Is 8 minutes like I'm done after that?
Well, no, I mean, traditionally, when in a traditional setting, they won't grade anything over 8 minutes. They won't take it into consideration. Is why I do that. But this is a little separate issue. But I do want to, I mean, this is a special circumstance, should I say, but I do want to notify you if you hit that. Thus far, no one has. Some people have come close, but no one has. I will start the stopwatch on your first word of your presentation, all right? Take a deep breath. This is all yours, man.
Hello and good morning. My name is Clay Williams, and today I'll be speaking about the impact of opioid abuse globally and how this problem can be solved. I'll be providing a scientific outlook on the issue. Opioids are a necessary medication when used properly, but are abused every day worldwide by millions of people. By a show of hands, who has been exposed to opioids in their life? This should be around half the room, considering that in 2017, there were 58 opioid prescriptions for every 100 Americans. That means that over half of every American has been exposed to opioids at some point in their life. To make matters worse, 20% of Americans get addicted to opioids once prescribed them. In 2018, there were 67,000 opioid-related deaths, making it a leading cause of injury-related death in the United States. Of those deaths, almost 70% involved a prescription or illicit opioid, but yet nothing is being done to slow the addiction rate once prescribed opioids. This is not simply a local problem in America, but a worldwide issue that needs to be addressed. Globally, there are around 16 million opioid users. 110,000 people die annually around the world due to opioid overdose, yet only 17.5% of people addicted to opioids get treatment to help their disorder. So the question is raised, how can we reduce overdose deaths worldwide? The answer is simple, fight opioids with opioid antagonists. To be able to fully comprehend my solution, one needs to know what opioids are and what they are used for. Opioids are substances that act on opioid receptors to produce morphine-like effects. Medically, they are primarily used for pain relief, including anesthesia. When taken properly, opioids are extremely beneficial to helping patients after surgery. Common side effects of opioid use are dizziness, nausea, vomiting, constipation, physical dependence, and respiratory depression. The main issue arises when a person takes too much at a time and overdoses on the medication. This is the primary cause of death related to opioids. My solution to the opioid crisis will be to regularly prescribe opioid antagonists after a patient has been exposed to opioids. Once prescribed, the opioid antagonists start slowly lowering the dose to wean the patient off the medication. There are different ways opioid antagonists work and help one stop using opioids. The two most commonly used opioid antagonists are naltrexone and brifetamine. They are both extremely effective but work in completely different ways. Naltrexone competes for opiate receptors in the brain and displaces opioid drugs from these receptors, thus reversing their effects. According to ScienceDirect.com, naltrexone binds to the nerve receptors in the brain and does not allow the user to get their high. Brifetamine has a different effect on the brain but is still effective for treating a disorder. Brifetamine acts the same way as naltrexone by binding to the nerve receptors in the brain, but brifetamine produces similar feelings of high on opiates, but a much weaker level. This helps the user avoid withdrawal symptoms and manage cravings so they can safely lower their dependency on drugs. Because brifetamine still delivers a small high, it does have the potential for abuse. However, it is near impossible that someone will overdose on the drug. Either one of these medications will seem suitable to stop opioid abuse. According to drugabuse.gov, there was a Swedish study conducted in 2003 that proved the effectiveness of brifetamine. The study compared a group of people that received 16 milligrams of brifetamine daily to a controlled group. The controlled group received brifetamine for 6 days, followed by a placebo pill. The study showed that the group that received 16 milligrams of brifetamine daily had a failure rate of 25%, while the group that received brifetamine for 6 days, followed by a placebo pill, had a failure rate of 100%. To consider the test a failure, the patient was to have 2 positive urine drug tests within a 3-month period. With this being said, a patient that is prescribed at least 16 milligrams of brifetamine for an extended period of time can treat an opioid disorder. As seen by the last study, brifetamine can be proven to be a viable option for treatment to an opioid disorder. Now let's inspect the effectiveness of naltrexone. According to drugabuse.gov, in 2010, there was a Russian study that tested the effectiveness of naltrexone. In their study, they tested extended-release injectable naltrexone, XR-NXT. It is administered once monthly, which removes the need for daily dosing. Typically, naltrexone has been administered once daily by pill rather than injection like XR-NXT. But the daily pill form of naltrexone has been proven to be less effective than the injectable version. The study was a double-blind placebo-controlled trial, meaning that one group was receiving the naltrexone medication while the other received a placebo. The XR-NXT group had a 90% success rate compared to the 35% in the placebo group. In the XR-NXT group, retention rates and drug cravings declined. The retention rates were 18% higher in the XR-NXT group, and drug cravings decreased by 13.7%. Through the results of this study, one can see that naltrexone can be used to stop the use of opioids. The downside of naltrexone treatment is it requires the patient to be sober for a month before starting the treatment. This can be an issue in patients that have been dependent on opioids for many years and haven't gone a day without them. The 2 forms of the medication are not only effective in stopping opioid abuse, but are not very expensive. Brifetamine is around $150 per bottle, and each bottle typically has 30 pills. While the pill form of naltrexone is around $40 a month, and the injectable form of naltrexone is $800 a month. The pill versions of both medications can be prescribed by any health worker that is licensed to prescribe medications. This includes licensed physicians, assistants, nurse practitioners, pharmacists, and clinical psychologists. In conclusion, to solve the worldwide problem of the opioid epidemic is to start normalizing the prescription of opioid antagonists after extended opioid use. The 2 medications highlighted are naltrexone and brifetamine. They are both extremely useful, but are used in different ways depending on the needs of the patient. They have been proven to be successful in stopping the use of opioids in multiple studies highlighted in the presentation. On top of their ability to perform well, they are affordable and convenient for the average American to be prescribed. Thank you for your time.
All right, fantastic job. Woo! Let me pause the recording here. Guys, y'all did a great job while I'm finding my button here. Y'all really did. Very proud of you. And